Hello, this is Valerie Cordero, Co-Executive Director of Families for Depression Awareness. It's my pleasure to welcome you to our Teen Depression webinar, Understanding Teen Depression. Thank you for taking time out of your day to learn more about how to help a teen. Toward the end of this 75-minute program, we will have time for question and answer. We'll be pulling questions both from the registration forms and from those asked during the live webinar. If you'd like to submit a question, use the question panel on your screen. We will try to answer as many as we possibly can. You can download a handout of the slides by clicking on the PDF file at the top of this screen. We hope you will fill out an online evaluation after the webinar because your feedback helps us to improve our program. As a thanks, we will send you a free copy of Teen Depression Selected Readings, 12 pages of information on teen wellness, mindfulness, stress, and self-advocacy. Please explore our website, familyaware.org, where you can find a downloadable teen depression fact sheet in English or Spanish, tips for supporting a person with depression, and information about how you can get involved with Families for Depression Awareness. If you find that this webinar is helpful to you, please forward the link to your friends and colleagues. The recorded webinar will be available for viewing through our website for a limited time. Finally, we hope you can help us reach more families and help more teens by making a tax-deductible contribution to Families for Depression Awareness. So, now that we've gotten all of that out of the way, we are going to start our presentation. As you see on the slide, this is our agenda for today. We are going to have an introduction, which I just did. Then we are going to have Dr. Freistad talk about depression. We will then talk about treatment, what treatment looks like and what it entails. We'll talk about how you get help for a teen who's dealing with depression, communication strategies, and then I'll take over for a little while to tell you more about Families for Depression Awareness before we end with our question and answer period. Now I'd like to give the presentation over to Dr. Freistad. Dr. Mary Freistad is a professor of psychiatry, psychology, and human nutrition at The Ohio State University and the Director of Research and Psychological Services in the OSU Division of Child and Adolescent Psychiatry. The focus of Dr. Freistad's practice for the last 30-plus years has been to improve the diagnosis and treatment of mood disorders in children. We are also very fortunate to have her as a member of the Families for Depression Awareness Advisory Board. Dr. Freistad, welcome, and the floor is yours.
Thanks so much. I appreciate it. So welcome to everybody. Good afternoon or evening, depending upon the time zone you're in. We are going to be talking about depression in adolescents today. And I would say that everybody knows somebody with depression. There are lots of just incredible people, and you see all the pictures on this slide, really wonderful people who have accomplished fabulous things in their lives who have suffered from depression. So I think a really good anti-stigma kind of campaign is important to have, and to know that there are many people who have been successful. It's also important to know that depression is very common, surprisingly common among adolescents. By the time they reach their mid-20s, 1 out of 5 teenagers or young adults will have had depression. So that's just an incredibly high number. We have good news and bad news. Part of the good news is that depression is very treatable. More than 85% of teens with major depressive disorder will improve with evidence-based treatments. That might be psychotherapy, it might be medication, or a combination. Some of the bad news is that not everybody gets the help they need. We know that half of teens in general who have mental health disorder difficulties do not get treatment, but nearly 2/3 of teenagers with major depression do not receive treatment from a mental health professional. And there's some unpleasant consequences. Untreated depression is not a good thing. It is associated with many complicating factors, such as substance misuse, increased rates of smoking, which is not good for your physical health, academic failure, problems on the job, impaired relationships both with family and peers, bullying. You're either the bully or you're getting bullied, eating disorders, increased severity of other health conditions such as asthma and obesity, and we're beginning to learn some really interesting kind of what the fundamental science is underneath that, and it looks like inflammatory markers are really something contributing to physical and mental health issues. And then we know, very sadly, that suicide is the leading cause of death for 15 to 24-year-olds. So what is depression? Every teenager has good moods and bad moods, just as any adult or young child has good moods and bad moods. But this isn't just normal teenage moodiness. Depression is really, we think of it as a medical condition. It lasts longer. By definition, it has to last at least 2 weeks. I have never, ever treated somebody who came in for an evaluation because they'd been sad for 2 weeks. You're lucky if you have figured out that you need to make a referral, and usually not even within 2 weeks' time. So we usually see people after they've been suffering a long time. And it interferes. I like to say it's a problem when it's a problem, when it's getting in the way of where our teenagers functioning, school, home, peers. And it's a change from baseline, unless a child has had kind of what I would call the low-grade fever of mental health, what we used to call dysthymic disorder, and our new term for it is persistent depressive disorder. Some kids have that for a long time before they develop a major depression. In that case, it might be less of a dramatic change, but it still reflects a change in functioning. We do know that depression can begin at a very early age. There are some very well done studies demonstrating depression in preschoolers. It is not common in preschoolers, but can happen. We certainly see depression in childhood. We know that at least half of all cases of depression begin by the time the person is 14 years of age. And then the question is why? Well, one of the first trees that we bark up is the family history tree. So we think about genetics. We know that children who have at least one parent with depression are 3 to 4 times more likely to develop depression than children who do not have a parent with depression. We believe and have good evidence that there is fundamental difference in physiology in people who become depressed, particularly the younger the age of onset, probably the stronger the family history, and more something clearly wrong in biology. We know that abuse or neglect or trauma can lead to the onset of depression, but not everybody who has depression has experienced that. We know that other stressful life events such as illness, the loss of a family member, or other ongoing stressors can lead to depression. We also know that some kids really get it with no apparent provocation. What are some of the signs and symptoms that you would be looking for in somebody who is depressed? Depression, the mood change itself can really take a variety of forms. It might be sadness, which is what we first think of when we think of depression, but it can be really cranky irritability. It can be a lot of anxiety or just a feeling of complete emptiness, hopelessness. By definition, again, it has to last at least 2 weeks. And then a real decrease in interest or enjoyment in things that used to be fun. And this is not the same as a kid who maybe tried soccer and decided either they just didn't like it or they weren't very good at it and now they want to try a different sport, or they played piano and now they want to try a different instrument, or, you know, they're kind of learning what they like. That's fine. That's normal, typical child development. But what we see in kids who are developing depression is they just stop having fun. They're not really enjoying anything, even when there are enjoyable opportunities around. The other kinds of things we look for are changes in more kind of physical kinds of indicators, so sleep or eating, too much or too little. And with this, we also need to keep our common sense filters on. So we know that there are lots of reasons that teenagers don't get enough sleep at night. Some of them can actually contribute to a real depression because kids become so vulnerable because they are not getting enough sleep. So kids and social media, that's a very hot topic these days. Kids maybe aren't getting enough sleep because they've got their smartphone under their pillow at night and they're texting their friends and sharing photos at 2 in the morning. And then that means you aren't sleeping. And you probably are getting into conversations you don't need to be getting into, certainly not at 2 in the morning. So sleep, not enough or too much, but what we see in so many teenagers is not getting enough sleep. Again, eating too much or too little, energy levels and activity. And again, if you aren't sleeping enough, there are going to be times when you just are feeling like you're absolutely dragging, and then kids will drink a couple of Red Bulls on their way to school, and then they're jittery once they get to school. Not so great. Sense of self-worth being really significantly diminished, or feeling guilty for things out of their control. If a child or teenager has done something really wrong, like they've been shoplifting or done something incredibly mean to their friend and now they're feeling guilty about it, good. They should feel guilty. They shouldn't have done that thing. But if you're feeling guilty because Nebraska has just had a terrible flood, and if you were only a better person, Nebraska wouldn't have flooded, that's really going too far. Where it gets a little trickier is when if parents are having their own marital issues and have been fighting, and a child might say to me, well, if I was a better kid, mom and dad wouldn't be fighting. And it might be that some of the fights are around dealing with this child. So if kids have really heard parents arguing about the child, that gets a little bit trickier to sort out, but certainly in therapy we try to help kids understand that if parents are fighting, that's really up for the parents to resolve, and it really should not become the blame of the child, and they should not feel guilty for that. Personal hygiene. Suddenly kids stop taking care of how they appear. Inability to concentrate or make decisions. That's why we get a lot of referrals during the school year. Teachers will send in referrals. Again, physical health might be non-specific aches and pains like headaches or stomach aches. And as I mentioned earlier, we've got lots of health conditions associated with depression. Teenagers oftentimes will want to hide their pain for a variety of reasons. One is they don't want to worry their parent. Let's say they already know that their parent is having a lot of stress. They may not want to further burden their parent. They may not want other kids to know, because the last thing you want to do is look weird as a teenager, so you don't want to draw attention to yourself. Some kids may feel like they are not worthy of feeling happy, which is part of the depression. So there are lots of reasons that kids might hide their pain. There are a couple of indicators really that we have for immediate action. If kids are engaged in non-suicidal self-injury, meaning they're cutting or otherwise hurting themselves in a way that wouldn't lead to death, or we have reason to suspect that they are thinking about ways to kill themselves, making a plan, potentially having made an attempt. Those are risk factors that we really want to get into quick action. So again, non-suicidal self-injury, deliberate harming oneself without lethal intent, where the kid who's doing it is not trying to kill themselves, but typically they talk about, like, I'm not feeling anything, I'm feeling numb, so I want to at least feel something. Or I'm feeling so bad that if I can cut myself, at least there'll be a reason that I feel bad. So lots of reasons that aren't very healthy that explain why kids end up cutting. This can happen with both boys and girls, affects all races, all ethnicities, nobody is immune, and again, sadly, 15 to 20% of adolescents at some point will self-injure. So it's important to take action if that's happening. What you as an adult might notice, scars, cuts, bruises, other wounds, if they're keeping sharp objects on hand, if they're wearing long sleeves or long pants in hot weather when normally they'd be wearing short sleeves or shorts, claiming to have a lot of accidents to kind of explain why they've got these bruises on their body. Maybe they're pinching themselves and leaving bruises. So what do you do if you see that? Well, you want to assess how immediately dangerous it is. You may need to seek medical attention, but most typically when a teenager is engaged in this non-suicidal self-injury, it's not something that really needs medical attention in the sense of like needing to get stitches or something, but you certainly do want to respond to it. You don't want to, if you can you're going to need to take a few deep breaths because this is not easy. You're going to want to respond as calmly as you can in a private setting. Something to the effect of, I noticed that you've got some cuts on your arm. I'm just wondering kind of what's been going on. Are you doing that to yourself? Ask some respectfully curious questions. Where else on your body might you have kind of done something to hurt yourself? Do you do that when you're in certain moods? Engage the young person in identifying the next steps. I'm concerned that you've been doing this. I think it's time to find somebody that you can talk to come up with other ways of coping when you're having strong feelings. And then make sure you find a mental health provider. In terms of suicidality, some people believe that if you ask a kid about suicide risk, you are planting a seed. I can guarantee you there are very few children or adolescents in today's culture who haven't heard of suicide. It's pretty rare. So it's not like you would be putting some new thought into their head or giving them the idea that they should think about it. But if you are concerned that somebody has been thinking about it, we kind of go in a range from passive ideation to active ideation to having a plan to making an attempt. So passive ideation is thinking, the world would be a better place if I'd never been born. More active is, I think I might want to do myself in, where it's kind of starting to think about truly taking action. What are some of the risk factors for suicide? If you already are diagnosed with depression or substance use disorder, if the child has impulsive or aggressive tendencies, if there's a history of trauma or abuse, if they've made a previous attempt, if there's a family history of suicide, if they've recently lost a relationship, a boyfriend, girlfriend, best friend moved away, somebody else, a trusted close person in their life, if they're feeling a lack of social support, they're feeling isolated, hopeless, and if there's easy access to lethal means. So it's important to have guns locked away, lock and get them out of the house if you have concerns about a teen being suicidal. If there's been a major physical illness, if there's been a cluster of suicides in your community. There's still a lot of stigma associated with asking for help, including for some people cultural or religious beliefs. Exposure to others who've died by suicide in real life or via the media or internet. We had the whole 13 Reasons Why debacle not very long ago, where that, again, kind of suicide becomes almost glamorized. What are some warning signs that you should be aware of that you would want to get somebody help urgently? If a teenager is talking about wanting to die or to kill themselves, if they're looking for a way, a method, searching online or trying to buy a gun, they're talking about feeling hopeless or having no reason to live, if they're talking about feeling trapped or in unbearable pain, talking about being a burden to others, I'm just bringing everybody else down. If they've recently increased the use of alcohol or drugs, they're acting very anxious or agitated or acting in a reckless manner. They're sleeping too much or too little. If suddenly they're withdrawing or isolating themselves. If they're showing intense rage or talking about seeking revenge. If they're experiencing extreme mood swings. And most of all, if they're giving away their prized possessions because they don't need them anymore. What do you do if you see those things? If they're you want to again ask in private if they're considering about suicide, and it's not a problem to ask directly. Are you thinking about killing yourself? Are you thinking about taking your life? Listen, look, do you have a plan? Have you thought about what you would need in making an attempt? Get those lethal means away. If you need to lock up medications, cleansers, chemicals around the house. And if your child is suicidal, do not leave them alone. You're going to want to get a hold of their clinician if they have one. You might need to call 911. take them to the local emergency hospital room. Here are some phone numbers and resources, and again, you'll be able to download that from the website. So those are some of the very scary warning signs. Let's move on and talk about what you can do, what treatment is all about. So if you're concerned about depression or suicidality, definitely seek a mental health evaluation. A good treatment really requires starting with an accurate diagnosis. There are lots of things that can mimic depression. You might have a thyroid problem. You might be anemic. You might have a learning disability. You might be miserable during the school year and fine in the summer because you just aren't learning in a typical way. So what goes into a thorough evaluation? We want to know family history, and family history does not provide a diagnosis for kids, but after I've made a diagnosis, inevitably a parent will say, but why my child? And I want to have some answer for that. And family history is, the first tree that I bark up. I want to understand how that child developed over time, starting from prenatally, how the pregnancy went, how labor and delivery went, how those early milestones came along, what the child's child care arrangements have been throughout their life, how they've been performing in school, what their relationships have been like with friends and family, what life stressors they've experienced, what medical history have they had, and what kind of treatments have they had for various medical conditions, which perhaps could trigger some symptoms or mimic symptoms. So depression can be mistaken for typical adolescent behavior, but I think we've maybe kind of disputed some of that already. We've talked about how it can present with some somatic kinds of symptoms like headaches, stomach aches, sleep changes, and it will frequently overlap or coexist with other conditions. Depression and anxiety go hand in hand very, very frequently, or an eating disorder or another behavioral disorder. And it'll look like perhaps like the child just has a bad attitude, not doing well in school, dropping out of co-curricular activities, etc. So again, those are some of the warning signs and some of the ways that it can appear. So what do? What is treatment? So talk therapy. There are many different therapies available, and it's important to really seek an evidence-based treatment, and you see some of them listed here. There are a variety of treatments. Some may involve the family. The older the child is, typically the less we keep the family involved in every single session, unless conflict within the family is a big part of what's driving the system. So we kind of need to have a sense of that as we decide what kind of treatment makes sense. For some kids, not all, medication is really important to treat depression. It can improve mood and functioning, but it'll take time often to find the right medication and the right dose. It's important to monitor both for side effects as well as positive effects. And it's important for both the teenager and their parent to know what the side effects could be, as well as what the signs and the sequence in which symptoms get better. And typically, the physical symptoms of depression will improve before the mood and cognitive symptoms of depression will improve. And then there are other interventions. I like to talk about seeing your way to better health. So sleep, eating, exercise. Cannot emphasize enough the importance of getting adequate sleep, getting physical exercise, preferably out of doors, where you also get vitamin D, and you get all the benefits. If you have a place where you can be out in nature, you get that added calming benefit of nature. And then eating healthful foods. We have clear evidence now that a healthy diet that is low in ultra-processed foods and high in all those things we know that are good for our physical health, fruits and vegetables and whole grains and lean proteins, nuts and seeds and legumes, those are all really good for us. So how do you go about getting help? Again, we talked about if there are any suicidal thoughts, behavior, talk, when symptoms have coalesced for a couple of weeks or longer, and when it's a problem, when these symptoms are clearly interfering with the teenager's ability to function. So where do you turn for help? Well, we know our mental health care system is overburdened. That's why so many kids don't get help. There aren't enough child psychiatrists to go around, so many people will get the help they need without a child and adolescent psychiatrist. Sometimes that is exactly what is most needed. but there are other mental health professionals who may be able to help. In terms of a prescriber, there are other options, your primary care physician, a nurse practitioner, but it's really important to get an evaluation by a mental health care clinician with sophistication in this area. And that could be really anybody in any of the disciplines you see here: psychology, social work, counseling, nurse practitioner, psychiatrist, but they really need to understand kids, families, and mood disorders. I think those are really the critical elements, and they need to understand what evidence-based treatment is all about. So who can you ask for help? The insurance company, you want to see who's on your provider list, assuming you're using insurance. You can go to your primary care provider to get referrals. The school professionals can be very, very helpful in this. So the school psychologist or nurse or guidance counselor may have a list of people in the local community who are really helpful. Neighbors and friends, religious leaders, calling local mental health centers or community clinics, hospitals, and particularly universities that have teaching hospitals. And then the Families for Depression Awareness is just an absolutely great resource, and you're going to hear more about the resources that they provide. So education is really important, and all of you who are on this webinar tonight, good for you. You are doing the right thing. One of the most reliable and effective interventions to prevent teen suicide is for teens to have a trusted adult to turn to, and for those adults to be aware of depression and suicide prevention. So it's important that you're doing exactly what you're doing tonight. You're learning about mood disorders, and you've got great resources. Family Aware has some absolutely fabulous resources. You want to educate other family members as well. You want to understand treatment options and ask questions. I encourage families who work with me to keep a notebook, write down their observations and questions, come in, ask me your questions, get them off your chest. Make sure you clear the deck after every time you've seen me. You shouldn't have remaining questions. You should have asked your questions of me. And this is a process. It will not always be as smooth or move as quickly as you or your teenager would like, but it's a path, and you're only going to be on it if you get started. It's really, really important for parents to take care of themselves. If your teenager has a mood disorder, it probably isn't going to be fixed quickly. So you want to take care of yourself. When your child is in crisis, you're probably dropping everything and you're in crisis too. But you can't stay in crisis mode. Your child will not be in chronic crisis mode. Don't let that happen in your family. You need to practice self-care. I like to say, if mama ain't happy, ain't nobody happy. Okay? So that's a really important thing. You think of this as a marathon, not a sprint. You need to be taking care of yourself. Get support. Model having a balance in your life. If you need a therapist of your own, don't hesitate to go and seek the help you need. Now let's talk about the importance of communication. What can parents do in talking with their teen? What teenagers tell us loud and clear is they don't want their parent turning into their therapist. Okay? You don't want to be their therapist, probably. But what can you do? You can be supportive. You can practice active listening. So rather than lecturing, remember in the Charlie Brown cartoons that we probably all watched when we were kids, what do the adults in the Charlie Brown cartoons sound like? Wah, 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 wah. And that's what we sound like when we start lecturing our children on all the great things that they could do to pull themselves out of their depression. Okay? So listen more than you talk. But definitely tell them that you love them. Talk to them about what their good qualities and strengths are. Not that that's going to just immediately pull them out of depression, but they've lost perspective. There's cognitive distortion in depression. It's part of the depression. They're not seeing their positive qualities. They're focused on the negatives. They need to know that depression isn't their fault. It's also not your fault as a parent or a teacher. It's not a sign of weakness. It's nobody's fault. These are no-fault disorders. Okay? But it's a health condition that deserves treatment. And your job as a parent is to support your child being healthy and safe. If you aren't the parent, let's say that you called in tonight because you're worried about your niece or your nephew, or you're a teacher and you're concerned about kids in your classroom. You might be that teen's trusted adult. Express concern to the teenager about what you've noticed in them. Encourage them to get help. Let them know you're not a clinician, but you think they ought to get a professional evaluation. Communicate with their parents. They may need education or coaching or other support. And if you are concerned about suicide risk, you can take some immediate action. You can call 911 if you are in a dire emergency, or you could really let the parent know your level of concern. Okay. And what if you are a loved one and supporter not only of the teen but of the parent, but the parent is like, or you're a teacher and you're really concerned and the parent is like, oh, I don't know. There are lots of reasons that parents hesitate. It's not because they're evil, bad, terrible people. They might have their own concerns. They might have had a bad experience themselves in seeking treatment. It might be that the parents involved are in a big war about this and many other things. There may be religious or cultural factors getting in the way. They may be concerned that their job really wouldn't permit them to get to a daytime appointment, so they just don't know how they could possibly seek treatment. They may not know how to proceed. You can be a helpful guide. If a parent says, they'll outgrow it, it's just a phase. Depression isn't a phase. It doesn't always last forever. It comes and goes, but it's not the kind of thing we want to have a child suffer through. An average length of depression on average is about 9 months, and that's a long time to have impairment. If somebody says, I don't want to label my child, you would seek help for any other label, for the flu, for a broken arm, for diabetes, any other label you would seek help for. And trust me, in the world today, teenagers are throwing these labels around like they're nothing. Kids today talk about, oh, he's so ADHD. Oh, she's so depressed. Oh, I get a serotonin surge every time I get a like on my phone. These kids already have the lingo, so don't worry about labels. They're already using them. You might be concerned that your teenager will refuse to see somebody, or they'll be mad at you, or that they won't talk anyway if they go. They don't talk to me. Why would they talk to a therapist? I can't tell you how many times a parent will look at me, roll their eyes, and say, I don't think he's going to talk to you. The minute the door closes, the kid talks. And if the kid absolutely refuses to go to the session, go without him. There are very few teenagers who want to think that their parent is going somewhere and talking about them where they don't have a voice, okay? So you don't like that I've been talking to a therapist about you? You don't want me talking about you? Go talk for yourself. No worries there, okay? And the teenager might be a little bit upset, but then you can say, you know what? When your depression is over, it's not like I want to keep dragging you to appointments. I just want to make sure you get the help you need when you are clearly suffering. If the parent doesn't know where to go, help them seek a school counselor, pediatrician, somebody, as we talked about. Many parents have a strong feeling of, I don't want my child to be on medication. Fine. Don't start with meds. Start with an evaluation. Build a treatment plan together. And if it becomes clear that medication is the next step in the treatment, learn about kind of what to watch for, what the options are. You can try a variety of options before you move to medication, but sometimes medication is the thing to do. Okay? So we've talked already a little bit about why teens might be reluctant. They don't want other people to know. They want it to be confidential. Certainly listen to their concerns and let them know that you don't need to be you're not going to go out on the street corner and, blast the news. You're not going to post it on Facebook and Instagram that your child's seeing a therapist. So respect what their concerns are, but let them know that you really do have concerns about their welfare and well-being, and that's why you are going to take them in for an evaluation. And with that, I'd like to turn it over to Val, who's going to talk about this fabulous resource, Families for Depression Awareness.
Yes, thank you so much, Dr. Freisted, for taking us through that information. We heard a lot of great content there, and trust me, we are seeing your questions that are being submitted. And for those of you, we are answering some of them as we go along, but others do stick around. We are going to get to your questions later on, as well as some of the ones that were submitted ahead of time. But for now, I'm going to talk a little bit about Families for Depression Awareness so you know more about who we are and what additional resources you can access through us. Our mission is to help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. We are a national nonprofit organization, and this mission really governs everything we do, from our programs and activities to the trainings that we offer to people like you. Our philosophy certainly is that depression and bipolar disorder affect the whole family. It's important that even though it might be mom or dad or the son or the grandmother who has depression, it really helps to have all the family on the same page in terms of the diagnosis, what the symptoms may look like, and how you can be helpful and supportive so that that person has better health outcomes. What you're listening to tonight is part of our teen depression program, which includes a webinar workshop. We'll do this webinar again in the fall with a different topic area, so be sure to look out for that. We offer depression and bipolar wellness guides. We have teen speakers and some who are college age who can talk about their experiences with depression and bipolar disorder to help eliminate stigma around these issues. And for those of you who may not be able to access those folks, we do have videos and family stories as well as expert interviews through our website. If you are in the Massachusetts area, we can send teen speakers to your school, community, your church, anything that's happening around you. We can bring our teen speakers to you, and we do get grant funding to do that, so please reach out to Jenny. Her contact information is on this site, is on this slide right here. So moving on. The hub of our resources is our website, familyaware.org. Most of you probably passed through the website in order to register for this webinar this evening, but be sure to click around after we're done and look at some of the other things that we offer. Which includes information about other webinars. Some of these are pre-recorded, and you can access them at any time. We will be doing, as I said, another teen depression webinar in the fall. We will have one on adult depression later on this spring, so keep an eye out on that to see if there's something else that will apply to you. We also offer some web tools, including our family tree, our mental health family tree. That's something that you can go through and enter in information about the different relatives in your past and print that out and take it to a mental health appointment if you are trying to help your doctor or your loved one's doctor understand the history of mental health in your family. We also have a depression and bipolar test based on the PHQ-9 and the MDQ, which are evidence-based tests to let you know if depression or bipolar disorder are likely. That's another test you can print out and bring with you to an appointment. In addition to those tools, we also offer several publications, including our wellness guides, and we are so very excited about 3 brand new publications that we have spent the last 9 months or so producing. You can see the little teal one that's about adult bipolar disorder. It has stories of families, and not just families who have gone through good times, but those who've been through bad times and how they've come out the other end. We as well have a companion piece, the adult depression brochure there, which again tells family stories, real stories about people and how they've dealt with these issues. And the bigger image there on the left is our brand new Helping Someone Living with Depression or Bipolar Disorder Handbook for Family Caregivers. This has been a labor of love we've worked on for a very long time. It is a comprehensive handbook for caregivers. It's over 50 pages long, and it's going to be a great resource, and we are printing them almost as we speak. So we are excited for people to be able to get their hands on that if you are a family caregiver. Please check out our blog called Care for Your Mind. This is a blog where we discuss issues of mental health care access and advocacy. You can see stories from experts as well as stories from individuals who are trying to navigate the mental health care system and how they are doing that. We want to point you to some additional resources. If you are downloading these slides, you'll be able to go to the websites of these great organizations. Somebody mentioned the questions that 211 is in every state, and you can call that number in order to get some referrals and information about resources in your area. So thank you for the person who submitted that in the question and answer panel. But make sure you, if you were looking for other resources, you can start with some of these other great organizations, as well as some resources for preventing suicides. QPR is a great training for you to be able to understand how to recognize suicide and intervene. That's called QPR, Question, Persuade, Refer. There's also mental health first aid and some other resources here. We want to thank Dr. Freystedt. Again, everybody stay around. We're going to go to question and answer, and we're going to have a good long time. So we're really excited about being able to get to that. But we want to do our thank yous, so we make sure we get those done. Thank you, Dr. Freystedt, for your time and your expertise. We also want to thank those generous funders who support our program, including the George Harrington Trust, Middlesex Savings Charitable Foundation, Rebecca Pomeroy Foundation, Thomas Anthony Pappas Charitable Foundation, Bennett Family Foundation, I Am Strong Foundation, John Donnelly Trust, Sumerian Foundation, Rhyme and Reason Fund, and of course also people just like you who donate and support our mission and our organization. Thank you so much. If this program was helpful to you and you choose to support us, you can do that also at familyaware.org. So thus ends my pitch. Thank you all for those of you who stayed on. We're going to get right to the question and answer. And Dr. Freystedt, we're going to start with a couple of the questions that were submitted ahead of time by people who were registered tonight. One person wanted to know, there's so much talk about the dangers of social media and how they can increase depression in teens, but someone's asking, are there any circumstances in which social media can help teens who are dealing with depression?
Absolutely, and I want to try to talk a little bit more about social media. We could go on and on. I wanted to make sure I got to the original content of the slides, but I'm really happy to talk more about that. So with social media, it's not a good thing or a bad thing. It's how it gets used. So using it, number one, almost every teenager in America is on social media. So to not be on social media makes you kind of one step removed from your peers. So the norm today is to be on social media. What isn't healthy is to be on it instead of being what teens call in real life. So if all of your social interactions or a predominant amount of them are spent on social media and you're doing very little face-to-face interactions with others, that's where it becomes a problem. But where can it be really good? Let's say you're kind of a socially anxious kid and you're just not quick at a response. Somebody says something good or bad and you're just sort of at a loss for how to respond. If you're texting back and forth or you're on Instagram or Snapchat or whatever your medium is, you have a little bit of time to respond. So it gives you time to think about what you want to say. So that's good. If you have, let's say you have some kind of unusual health condition and you just don't know a lot of, there's nobody else in your community with that health condition, but you're online with an online support group of kids who have the same weird disorder that you have, that can be incredibly supportive. Kids talk about, in a less kind of unusual circumstance, kids will talk about how it feels really good to be able to be creative and express their creativity in social media. So and being connected and making plans via social media and not being left out of the social loop. So it's not like social media is all bad. Where it gets bad is where it's out of balance and you're doing that instead of face-to-face time. So the way to, I think, inoculate yourself against negative effects of social media are to make sure that you're doing things in real life, that you're having face-to-face get-togethers with friends, that you're involved in activities, be it sports, music, drama, part-time job, volunteer work, anything that gets you out and about in real life.
And that really pretty much inoculates you against negative effects of social media. The other place where it's a problem, again, is if it's interrupting your sleep at night, which is really common for a lot of teenagers. And then if you don't get enough sleep, it just makes you vulnerable. So those would be some of my comments about social media. The other piece, too, is that there can be, like Families for Depression Awareness. There are lots of great resources on the internet and available on social media for kids who are seeking help. Now, anything that's powerful is powerful for the good or bad, and we've heard a lot about social media recently in the news. So you can also get, you can Google how to kill yourself and get really accurate advice on how to increase the lethality of a suicide attempt. That's a really bad use of the internet. So again, it's not neither good nor bad inherently, but how it gets used.
Okay, thank you. That was very helpful. So we have another question. There's a lot of people are trying to still parse out this difference between depression and other things they're seeing. So we got a couple of people actually who wanted to know, how do you differentiate laziness from depression? Someone else asked, how do you differentiate an extremely introverted teen from depression? We've gone through some of the symptoms, we've gone through the duration of symptoms, but Dr. Fry said, what if you're a parent and you just don't know if your kid doesn't like going out with other kids? They just like being inside. They like being to themselves. And you worry that, is this who they are, or is it depression? And then with the laziness, I'm assuming that the parents or whoever wrote that, their child, they're trying to differentiate between laziness and lack of interest in things.
Sure. Oh,
so
sure.
Can you speak to those, please?
Absolutely. Those are great questions and the kind of thing that'll puzzle a parent. So starting with the lazy, I guess I would want to know, is this child lazy about everything? Is this child lazy about socializing? Is this child lazy about the things that he's really interested in? Or is he just lazy when it comes to doing chores around the house and cleaning up his bedroom and doing homework, especially for the classes that he doesn't like? So I would want to figure out how extensive this laziness is. And if it's laziness around unloading the dishwasher, cleaning the bedroom, and doing calculus, get to work. Up the ante a little bit, Mom and Dad. Sound like it's time to kick it into gear. But if it's just sort of if there's a kid who's pretty blasé and doesn't really have a lot of motivation for doing much of anything, I would also just check any reason to suspect substance use. Because you can be smoking marijuana on an everyday basis and just be pretty laissez-faire to the point that you aren't doing much. Not necessarily marijuana, but that's a common culprit. So I would just want to check about things like that. So you kind of want to sniff around, literally sniff around if you're suspecting marijuana. But those would be some of the things I would think about with laziness. With an introvert, that's a whole other really interesting question. And with that, if there is somebody who is not ever going to be, the high school homecoming queen, great, fine. But if they have one or two friends and they really enjoy being by themselves and reading and writing poetry or, kind of whatever kind of, and they're really content if they're happy by themselves, great. That speaks to their temperament. Nobody said everybody has to have the same temperament. That is not what we are looking for. That is not introversion is not a diagnosis. If you're content when you're by yourself, the difference is we see a lot of kids, and anxiety and depression go hand in hand so frequently. And we'll see a lot of kids who are, quote unquote, introverted because they are socially anxious. And that's a different thing. So if you would like to be able to interact, but you're so anxious around other people that you withdraw, you'd rather be homeschooled, you don't want to be involved, you never raise your hand at school because you don't want to hear your own voice. That's a little different from kind of what I think of as an introvert who isn't ever going to be the life of a party, but would rather have one or two close friends. That's different than a socially anxious person who just, wants to kind of withdraw from others and is very uncomfortable about it.
Okay, those are wonderful things to think about for parents in those differentiating those behaviors. I'm going to move now to some questions that have been asked live of people who are listening, and I'm going to combine two because there is a general theme around what to do if you don't have all the adults that are necessary for moving forward with treatment. What can you as a caring adult do in the interim? In one of the circumstances, the question is about divorced parents, where one parent believes that there's an issue, there's a diagnosis, counseling is needed, and you need to move forward with treatment, but the other parent is not on the same page. In another question, the person is talking about children and adolescents living in foster homes where they may be dealing with depression, but you need permission from birth parents in order to seek treatment. So in both of these cases, there are caring adults who see that there's an issue, but there are barriers to getting that child, that teen, treatment in the immediate time frame. So what are some suggestions you may have for these situations?
Absolutely. So I'm glad you gave me some of the details because I'll say slightly different things for the two circumstances. In the case of the divorced parents, it depends upon kind of how the no is. It might be that one parent is really seeing the need, and not to be stereotypical, but the most common way that this presents in our clinics is mom wants the treatment and dad's like, oh, you're just babying her, So dad might be the no voice. It doesn't always play out that way, but that's the most common way it plays out. So if mom, if I'm going to be seeing a family where parents are divorced and they both have a say-so in healthcare, if dad says, over my dead body is my child going to be in therapy, I'm kind of stuck. But if dad says, I think it's a stupid waste of time and I'm not going to pay for it, but if mom wants to, and their divorce decree is such that if mom wants to go, she can go, but I'm not going to be involved, then I'm going to do what I can with mom and kid. Okay. In the foster home situation, if you need to have the legal permission from birth parents and you're not getting it, and foster care can have a variety of circumstances, but if that's the circumstance, then what you can do is all of those things that we talked about in terms of kind of being that listening ear and helping them see what their strengths are. You could get the resources from families that you just saw about some of those workbooks, and you could do those workbooks together with a teenager where you clearly are saying, I'm not a trained therapist, I'm not trying to be your therapist, but here are some really great resources that can be helpful for people who are dealing with depression. Maybe I can kind of be around and help you think through some of that. Again, you can hear what some of their concerns are. You can use what we call Socratic questioning, which is helping kids rather than lecturing them and telling them. Here's a grand tip for all teenagers: never tell a teenager what the solution is because they probably won't accept it. Ask enough questions of them so that they tell you what the solution is, because then they'll take ownership of it, or the greater likelihood that they'll take ownership of it.
Okay, thank you. So we have a question that was submitted ahead of time that said, children with cognitive disabilities also get depressed. Are there signs and strategies to address them that are different than what you would for a different population?
Sure. And so if we're talking about kids with, it depends on how significant the intellectual disability is. Let's say you have a measured IQ kind of in the 60s and you're 15. And if I was to work with you, I would be asking you the same kind of questions, but when I'm asking you about mood, I might try to turn those questions into something that I want to really make sure you're understanding what I'm asking. If the IQ is significantly lower, or the child is younger, what we sometimes will do is pay a bit more attention, because if we aren't getting a very accurate read of what the child is able to say they're feeling, we're going to go with the nonverbals and we're going to go with the physical symptoms. So if the child used to be somebody who played and had fun and was happy, and now is just looking sad and glum or angry, and their sleep is off, and suddenly they're eating a lot more or a lot less, and their behavior at school has changed, makes me think there's something really wrong, and depression might be the thing. So, I'm going to try to ask about feelings. I'm going to try to ask about why they think they're feeling the way they are. But if it's really, really hard to get that communication across, then I'm going to, again, go with the nonverbals and the physical symptoms as my indicators. But we certainly can go ahead and treat depression. And I would go back to may or may not need medication, but I would think about sleep, eating, exercise. I would think about what we call behavioral activation, which is making sure that the child has something fun to look forward to every day that they can enjoy, and see if that starts to brighten their mood, help them make plans about what they could do that would be enjoyable, help them solve the problems in their life that are complicating things and are making life unenjoyable, and see if some of those more concrete. So we, in the CBT is cognitive behavioral therapy for kids who have a harder time with the cognitive part of it. I just focus more on the behavioral part of CBT.
Okay, great. We have a lot of questions about some other physical things that might be going on in a teen that could be either affecting depression, causing depression. We have questions about progesterone, thyroid, testosterone, environmental factors, the crap food that we eat in America. I mean, America has wonderful food, but we also have a lot of processed food. So I guess to get all of those questions, all of those issues together in one question, can you speak a little bit more about the extensive nature of evaluation and some of the things that you need to look at before going straight to treating the depression, because people are worried about these other things that could be affecting their child, and they want to go to that cause first rather than look at the depression first. So can you comment about those issues?
Sure. So it's always really good. So whenever I'm evaluating somebody, I'm going to make sure that I've checked to see, have they had a physical exam for kids? Have they had a physical exam in the past year? When have they last seen their primary care provider? This is why I'm a huge believer and supporter of truly sticking with your primary care provider. And yes, that urgent clinic down the road might be convenient, but there's no continuity of care there. Yes, you can go into your local drugstore, into the Minute Clinic. Sure, you can do that. Oh, it's so convenient. But you're not building a relationship with your primary care provider. So whenever possible, stick with your primary care provider for every possible visit. I know it's not possible 100% of the time, but do try to build that relationship so that when something's wrong, the pediatrician or family physician would also be able to say, wow, that's not the way he's looked to me before, so that they've got some sense of it. But if you have any reason at all, and again, you want to make sure that there's been a physical exam, because certainly as kids are going through puberty, we see a lot of increase in depression. It's just a time when girls in particular are vulnerable, and the rates of depression in girls skyrocket around puberty. And it's probably hormonally related, but it's not like there's a hormone treatment for it. It's not like, oh, if you just had this hormone, boost, you would somehow, be okay. It's more like there's something that happens to girls at puberty that kind of doubles the rate of depression in them. But again, making sure that if they haven't had a physical exam and there's any other sign whatsoever beyond what looks like depression, that there might be a physical illness, get it checked out. One of the beautiful things, too, about continuity of care in behavioral health is that I have the luxury of not having moved I've been at Ohio State for 34 years, so I have followed some kids for a long time. And I'm thinking of one particular girl who came to me when she was 11, and I treated her on and off throughout the years, hadn't seen her for a couple of years. This was a girl who was always very, very chatty about all of her friends. She had a very extensive social network, except when she was depressed. And she came in, and I asked, do you have a boyfriend now? She was a high school junior. Yes, she had a boyfriend, but she said, I just don't have the energy to see him. I said, do you have how are your friends? You had this friend and that friend. I kind of had to keep track of who all of her friends were. That was pretty important in our therapy sessions. Oh yeah, I still have these friends, but I just don't feel like I've got the energy to see them. So here she's talking about wanting to be with them. So there was no lack of motivation, but there was a lack of energy. And again, because I knew how this girl's symptoms of depression appeared over time, it's like, you might be depressed, but I think you have mono. You're telling me you don't have energy to do anything. She said, no, I just had the rapid mono test from my pediatrician. And it's not very often that I would be so firm, but I just knew this girl. And I said, I know you had the rapid test. Go back and get the 24-hour test. I think you have mono, and my psychotherapy is not going to treat mono. Sure enough, she went back. This girl had mono. I could not psychotherapize her out of mono. So there are times when there's something else going on. Girls, particularly early in when they start their menstrual cycle, they're early in their periods. If they're having heavy periods, a lot of girls become anemic. It's really common in teenage girls to be anemic. So if you suddenly don't have energy, and you're looking lethargic and you're a little cranky if your periods aren't going so smoothly, you might need to do something about that. You might need to have an iron supplement. If your periods are really awful, you might find that getting on birth control, not because you are needing birth control at that point, but because you need to regulate periods, sometimes that really can help mood. So, you always want to think about that. If there are other signs of thyroid where you are over or underactive, getting your thyroid panel checked. So again, you want to make sure that a child's been checked out physically. Those are really important things. So that's part of the answer. Then you asked about environmental factors. Sleep, eating, exercise. I can't say enough about it. We have done some research with nutritional interventions, and I would say that there is a growing literature on that. It is not as strong of a literature currently as I would like it to be. It's not that we have negative studies, we just don't have enough studies. But we do know that omega-3 fatty acids can be helpful. We know that there's a broad spectrum nutrient that can improve mood for some people. It isn't going to work for everybody. But in terms of general dietary intake, we now have enough studies that show that, again, eating a healthful diet, lots of fruits and veggies, minimize the fast foods, processed foods, lots of sugar and white flour. Try to decrease that. Try to increase your beans, your the legumes, the whole grains, limited sweets, limited soda, diet soda, not great for you. So all the things that get advertised, the more they're advertised, probably the worse they are for you. Okay. So if you kind of think of that as your golden rule, think about turning creative habits into learning how to prepare foods from scratch, from basic ingredients, things that don't have chemical names, things like broccoli and cheese, and things that have names to them. Try cooking with them and see if that is useful. Getting enough exercise, super important. We are a very sedentary society these days. And again, as I said earlier, if you can get your exercise out of doors, there's a reason that all of us who wear Fitbits want to get to 10,000 steps every day. It's really good for your mind and your body. We have really clear evidence that depression that moderate exercise can improve depression in adolescents and adults. So what a great way to beat depression. Get enough sleep, exercise, socialize, eat healthfully, do some creative getting together with friends and cooking together. Be creative. Come up with healthy menus that taste good, that you like. Have fun in the kitchen. do things together as a family in the kitchen. What a great thing to do.
Yeah, I know we all, as parents, can be a little bit better about those things, finding ways of incorporating that and making it a family-wide change so that the teen isn't just doing it by themselves.
And while we're on families and dinners, let me recommend a family dinner as many nights a week as you can humanly arrange it. And if you need to pick up some hopefully healthy food on the way home, do that. But there are lots of actually really easy ways to make healthy food at home, and it's a great way. And then if you have a rule, no phones at the table. Nobody may be on their phone during dinner. No texting during dinner. Phones get put away, and we're going to talk to each other during dinner. What a grand idea.
We all can be better about implementing that. But yes, it could certainly help with a teen who's already feeling maybe a little isolated or needs that connection a little bit more, needs the support of their family and to feel it more than just words.
And I will tell you that in this past generation, as kids have increasingly turned to their cell phones, their ability to maintain conversations with adults has decreased. And so practicing, as corny or as awkward as this might sound, practicing talking to each other, making eye contact during a family dinner is a great thing to do.
Yes. So I'm going to, again, just try to summarize a couple of the questions that we've got that have some similar themes around being able to know, or as best as possible, suss out if a teen is telling you the truth about their real feelings. There was recently a story that was out in the news media about a young lady who was a very high achiever and seemed to be doing well, and the parents later found her diary after, unfortunately, she died by suicide, and found that she was in fact feeling very, very down for a long time. Some parents are writing about, their team seems reluctant to get help, but they may not know if that's because what that's due to, because they're having a hard time either getting the teen to open up. One parent just said, "How do I get my teen to talk to me?" So, can you touch on getting to your teen's real feelings as much as possible, building that trust? And for some parents, it's really scary to think that I think I know my kid, but I might not.
Right. So a question that is usually worthless is, how was your day? Because we all know what we're going to hear. Fine. Okay. So think creatively about how to have conversations. And it could be a little exhausting. I understand parents might start to be a little frustrated, like, why am I doing all the work? But hopefully it'll pay off. To ask some more specific questions, or to say, hey, here's something really great that happened in my day. What great thing happened in your day? Or, do you ever have the problem where somebody does something that's like super irritating? This is an irritating thing that happened in my day. Anything like that happen in your day? Just, again, try to pull out some more specifics. Who'd you sit with at lunch today? If they're in a sport, asking them some more details about how practice went. Do you feel like your game's getting better, staying the same? Are you in a funk? Those are pretty common. Again, trying to drill down a little bit rather than kind of the generic "how was your day" question.
Great. So we're going to move to another question that was submitted ahead of the webinar, and we'll probably have enough time for maybe 2 more questions, 2 or 3, and then we're going to go ahead and wrap up. What are some of the biggest mistakes that you have seen parents made that you would maybe advise the parents who are listening tonight not to do when handling depression in their teens?
Don't tell them just to snap out of it. Having a teenager who is depressed can be exceedingly trying for a parent. I have yet to meet a parent, whether they have a kid who's depressed or not, who hasn't totally blown it as a parent. I'm speaking for myself now. We have all screwed up as parents, where we know perfectly well after the fact that we screwed up. So let's suppose your teenager is irritable, hypersomnic with diurnal variation, which is a fancy way of saying on the weekend he's going to want to sleep till 2 in the afternoon when you want him up and moving. And when he wakes up, he's in a bad mood and he doesn't have any motivation to do anything. He looks like a lazy, good-for-nothing jerk who needs to get going. And you basically say that to him. You also know he's depressed. And he says that, you say all that to him and you yell at him and you call him some names and maybe you swear at him and he slams his door and you think, good, I don't want to see your ugly face anyway. And then you think, wait a minute, what am I doing? I'm supposed to be the parent here, okay? So when you realize that, knock on the door and say, David, I'm sorry, I'd like to come in and talk with you. I don't want to talk. Well, then I'm just going to ask that you listen to me for a few minutes. I need to apologize to you. So one thing I would say is when you screw up, don't be afraid to apologize. That's not a sign of weakness. That's not putting you in the lower hand of the upper hand, lower hand. That's you role modeling, taking ownership of bad behavior, because as parents, we have all engaged in bad behavior and we should own it. And what you could do in that circumstance is come into David's room and say, you know, David, I really regret the words that I said. I know that you're dealing with depression. I had no business swearing at you. I had no business calling you names. I will tell you that I am so frustrated. I'm so frustrated with your depression. And sometimes it feels like I'm the only one doing anything about it. Where I get frustrated with you is when I'm not seeing you putting forth effort. So could we please talk about how you and I together are really going to try to tackle this depression thing? I know it's horrible, and it's got to be worse for you than it is for me. You're living with it all the time. I'm just observing it. But it's pretty frustrating, and I really want to work together with you to solve this.
Great. So we're going to do this question, and then we'll see if we can get to one more. We might have to end on this one just to get people out at the time we said we would. We have a lot of questions about medication, and those questions include questions of how long you think that a child could be on a medication before it stops working. So in other words, does any medication last for a child throughout their whole depressive episode or maybe throughout their chronic depression? There's some questions about what to do with mild depression. Is medication necessary for mild depression, or some of the other things that you mentioned? Are those also things that you could just start with and not look at medication? And then what are some of the side effects or things you should also consider if your child is prescribed medication?
Okay, let me start with the mild depression question first. That's super easy. Do not start with medicine. We don't have good evidence that medicine is good for mild depression, and we do have good evidence that sleep, eating, exercise, CBT, evidence-based psychotherapies are helpful. So please start there with mild depression. In terms of what I call the medication poop out, I see that more in bipolar disorder, and we've not talked at all about bipolar disorder tonight, so let me just make a couple of comments about that. Depression is the biggest part of bipolar disorder, and it is easy to come in when somebody is depressed and the child who's had a particularly if they've only had a hypomania and not a full mania where it's like super obvious that they've been like really out of control or doing really erratic things. They may not talk about the hypomania because it kind of felt good. But so it's important if you've ever had a time when your child has had 2 or 3 days at least or so of really charged up behavior, what I call the too muchness. Don't need to sleep. Now, one night of not sleeping, when we think about sleepovers, you know why you call them a sleepover? Because you sleep when they're over. So that doesn't count. So we're not looking for like one night of not sleeping. But if you've got a pattern of suddenly needing much less sleep and you're all charged up, then you're kind of showing some pretty poor judgment and you're maybe talking faster, louder, etc. that's the time to be thinking about the bipolar spectrum, which we really hadn't talked about tonight. That is what made me think about the poop out factor with medicine, because I see it fairly often in bipolar disorder. I have seen it less in depression, but it can happen in depression. So a higher dose is not always the solution. Sometimes it's switching medications is the solution. And that's something really important to have discussions with your prescriber about.
Okay, great. I think we're going to have to end it there. Thank you so much, Dr. Freystedt. I'm glad we were able to get through a lot of your questions for our viewers' questions, so we appreciate it. We want to just give you all a few reminders. Please do complete the survey. It should pop up at the end of this presentation, and if you fill that out, you will get a free copy of Teen Depression Selected Readings. We want to encourage you to look at one of the resources that we have, which is a family action plan. If you know that your teen has depression, but the family members need to get on the same page, this could include mom and dad, grandma and grandpa, brothers and sisters. We encourage you to start by making a family action plan. Figure out who should do what. Make sure you understand what you all believe the biggest issues are, and then move forward in the ways that have been outlined in this webinar tonight. We also encourage you to visit familyware.org. Thank you so much for participating. And remember that we want to always leave you with hope. There is hope. If your teen has been diagnosed with depression, they can get well, they can get better, and you can have that teen that you love, that you know, and who can be the best person that they are. So we thank you for listening. Thank you, Dr. Freystedt, and we hope you enjoy your evening.